Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entrée Pilote. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
So those are the problems that we can encounter with the uterus. Most commonly is the myomas. So the myoma will not stand in the way of pregnancy. You will get pregnant. It's just continuation of the pregnancy is the issue. As long as the myoma is in the way of expanding that uterus, the pregnancy will drop. Okay. If it's a small myoma, then you still can get pregnant if it's not in the way of expanding that uterus. And at the time, if the myoma is big enough, at the time of delivery, the specialist will do the C-section and take out the myoma both at the same time. So you don't have to go for operation twice. So now, myomas only depend on the size and the location. Size and location that will determine whether you can get pregnant and continue to have a successful pregnancy or not. Okay, so location, the type of myoma, is it subserosal outside the wall of the uterus or within the wall of the uterus? That is very important for us to determine. How would we know that? Well, very easy. We just put the ultrasound and we see the myoma is where and how big it is and whether it's going to be an obstacle in the way of the pregnancy, continuing the pregnancy or not. So that is a very easy thing to deal with. And believe me, during practice, we seen myomas that is 2-3 kilos, okay? Talking about this much. And sometimes if it's subserosal, we can remove the myoma and the uterus is saved and the pregnancy will take place. And it could be very small myoma, but the location of it is very much restricting the endometrium where the baby will live, and you cannot continue the pregnancy unless you remove it. And if you remove it, you cause the scar. And if you cause a scar, the tissue are not flexible like it's supposed to be anymore. So it depends. Again, it depends. It's not like it's impossible to get pregnant with myoma, but it depends on its size and location. Most cases can be easily resolved if you are in good hands. Okay, now we finish, the sperms is already at the level of the uterus and is swimming all the way to the fallopian tube. This is where the other obstacle would be. This is where other problems could arise. If we have repeated infection, especially chlamydia, that is the most common. And the most common chlamydia, the infection is chlamydia that can really stand in the way of you getting pregnant. It's an easy to treat infection, but is also overlooked. Why? Because it doesn't have symptoms, especially in women. Only when it's chronic and it's too much of it and many other microbes with it, we get the pelvic inflammatory disease. In some cases, the patient cannot stand straight because of the pain. That's acute pelvic inflammatory disease. Acute pelvic inflammatory disease, that is something that, okay, this is a picture here where we can see the myomas. Okay, so this is the different myomas in different locations. So we can see, they could be they can be from the outside the wall, and also they can be from inside the wall. The one that is arising from outside the wall, that is what we call subserosal, that can easily be taken out. And we can see the one that are within the wall. Those are the ones that interfere with continuing the pregnancy. Thank you very much. So now we'll go to the fallopian. You can look at the same image also. Again, you see the fallopian tube. Please, if you can bring that image back, it's a very useful image. I really appreciate you. Okay, yeah. See the fallopian tubes there? You see the fallopian tubes? Those are the fallopian tubes. Now, the fallopian tubes, we can have a problem with the fallopian tubes. We can have adhesions, internal adhesions, meaning the adhesions is inside the tube. You know, this tube is one epithelial cell thick. So it's very, very, very fine, very thin. So if we have adhesion inside the tube because of the chronic chlamydia that was silent and you didn't bother to check, then we cannot do anything about that, because there is another kind of adhesions. Let's say you have appendectomy and some of the blood was left over in the floor of the pelvis, and this blood now caused what is called like a spider network. We call it adhesions. We call adhesions. So this adhesion is now from outside that is compressing the fallopian tube. We call that external adhesion. That is easy to deal with because laparoscopically, meaning we put a small incision, we go with a laparoscope, the TV on the wall, we look at the TV and we cut all those adhesions, and then the problem is solved. But with internal adhesions, how are you going to go there? You cannot go there. It's very difficult to go inside a fallopian tube and remove the adhesion. So what will be the easy way out? Routine check for chlamydia, because it is the most common cause for internal adhesion preventing pregnancy. And so this is number one cause for infertility. Now those are the three, is okay now. Those are the three main stations, you know, the vagina, the cervix, the cavity, which the uterine cavity, and then the fallopian tube. This is actually 4 different stations that the sperm have to go through. Now, what if the sperm can go through, because the sperm is very much microscopic, you cannot see it with the naked eye. It's a microscopic structure, it's a microscopic organism. What if it goes all the way, the sperm goes all the way to the fimbria? You see where that ovary are, we see where it says ovary. This is where the location where the follicle release an egg, and the sperm is already there because the sperm made the trip, the vagina, the cervical canal, the uterus, the fallopian tube, and now it met with the egg, and now it fertilized. Now the egg will divide into different numbers, you know, different numbers, 1, 2, 3, 4, and the numbers increase. Now, instead of one sperm going one way to fertilize the egg, we have now a structure, as something that is bigger, much bigger than a sperm, has to go back through the tube. So what if we have a small blockage there because of adhesion? What if we have a small blockage there because of adhesion? And that structure, that is the fertilized egg, that now start dividing to make the zygote, the small baby to be, cannot pass through. So what are you going to do? What's going to happen? It cannot pass through. So it's going to stay where it is, in the fimbria, and that larger structure next to the ovary. So it's going to stay there. And what's going to happen? It's going to start dividing. And she's going to think it is already home. So she's going to make that small zygote there, that small structure, soon to be a baby, is going to start growing right there in the fimbria. And it's going to be, trophoblastic tissue is going to be formed, the placenta, because she thinks that thing, small thing there, that's soon to be a baby, think that this is home. Because it cannot pass because of obstruction or partial obstruction of the tube, because of those internal adhesion due to the chlamydia, the chronic chlamydia, or sexually transmitted disease that you have and you have ignored for years, right? So it gets stuck. And once it gets stuck, she's going to think that this is home, and it's going to grow and grow and grow. And unfortunately, this is not the uterus. So it cannot respond by expansion due to the growth of that soon to be a baby. So what's going to happen at the end? Boom, rupture, because this is not a uterus. It was not made to take a pregnancy. So at the end, it ruptures. And this is what we call rupture ectopic pregnancy. So how are we going to prevent that? And what we need to know about ectopic pregnancy? That we'll talk about this in the next few minutes. You can take the image back and let's talk about ectopic pregnancy. So, anytime you don't get your menses, the number one thing that goes in your head is supposed to be, am I pregnant? So anytime you don't get your menses on time, the number one thing that should be going in your head is, am I pregnant? Let's do a pregnancy test. You go to the pharmacy, or you go to your clinic, or you go to your center, wherever you want to go. You do a pregnancy test, and you see the 2 lines there. When you see the 2 lines, it's positive pregnancy. You're pregnant. Now you missed your menses for about 2 weeks now, right? You did the pregnancy test, and it's positive. What is the next step? Oh, I'm going to wait to see the baby, and the baby is growing? No. If you are sexually active, you are at risk for all sexually transmitted disease, among which is chlamydia. So the next step you will do is to go to a doctor and get it checked out. Doc, I did a pregnancy test and it was positive. So what is the next step? The doctor will immediately put an ultrasound machine on and look inside the uterus to see if there is a pregnancy inside the uterus or is no pregnancy inside the uterus. This is step number one. Why I'm saying that? Because we are afraid the pregnancy is not inside the uterus. Like I just explained, the pregnancy could be in that tube or could be anywhere else beside the uterus. But the most common place is where? Is the fimbrium. The sperm goes, fertilize the egg, now the size is bigger, it cannot come back because of that partial blockage. It easily went in, but it cannot. Yes, thank you very much, Vola, I appreciate it. Yeah, that's exactly it. You see, that's the ectopic pregnancy, you see. So it easily went in, the sperm easily went in, but it cannot come back because now it becomes like a ball there. Yeah? So there's a lot of cells. Now, eventually, if it gets stuck there, that's an ectopic pregnancy. But if it moves, God willing, inshallah, it moves and it goes to the walls of the uterus, that's now a pregnancy inside the uterus, a pregnancy inside the uterus. And that's a pregnancy that is good, and inshallah it will be a valid pregnancy, and the baby continue to grow, and at the end of the term, the baby will be delivered healthy. But if we have a problem in the tube because of partial blockage, secondary to infectious disease, especially chlamydia, the pregnancy will stop right there in the tube. It will grow, and the tube, as we said, is thin. It cannot take the expansion and the growth of the baby, and it will rupture, and that is very painful. Thank you very much. I appreciate the image. Now, so what can we do? The doctor will look inside the uterus and will tell you, congratulations, you have intrauterine pregnancy that is valid, and this is how old is the pregnancy, few weeks, 3 weeks, 5 weeks, 6 weeks, 8 weeks, 9 weeks, 10 weeks. And if it's after 8 weeks, he will let you know that he will let you hear the fetus heart rate, and you will see the baby right in front of you. Movement is okay, the heart rate is fine, you know, the different organs are fine, the brain is developing fine, all the organs are fine. Congratulations. The other version of the story, we don't see a pregnancy inside the uterus. So that is an ectopic pregnancy. Meaning, ectopic meaning outside of the uterus. So that's and the most common place, like the image have shown, is in that fimbria or inside the tube. It is very crucial that once you're pregnant, you get to the doctor. Why? To determine whether the pregnancy inside or outside. So what is the big deal? The big deal is if you leave it for more than 6 weeks, it will rupture. And then you're going to have to go to emergency surgery. And if it happened to be in the weekend, no doctors are available, you know, for one reason or another, you are at risk to lose your life. Especially if the bleeding is active and is much. So what I'm going to do, again, you're pregnant, you see the doctor, the next very important step is to make sure the pregnancy is inside the uterus. The pregnancy is outside the uterus, that's an ectopic pregnancy. Depending on how old is the pregnancy, we can give you an injection at day 3, 5, and 7, and the pregnancy will drop. That is, the ectopic pregnancy will drop, and end of story. You're home free, no problem, no operations, no surgery, no rupture pregnancy, nothing. You saved yourself the headache. But the only element is early in pregnancy up to 6 weeks. Beyond 6 weeks, very much difficult. It has to be done by surgery.